Hey everyone, thanks so much for being here. This is Steve Jolly with SRJ Marketing Communications, and we are the creator of SRJEasyHealthcare.com. And I'm so glad that you are here. There's a lot that I want to talk about, and usually I start the program off with a statement. I'm not going to try to sell you anything. I'm going to try to inform you, but I'm not going to try to sell you anything. Well, today's going to be a little bit different because that's what this program is about, is to really not only educate and inform you of SRJEasyHealthcare.com, but actually to ask you to become a member. I think it's a great program, and you are going to find it to be a real important contribution to your marketing program. So, let's kind of get started and jump right into it here. It's about SRJ Easy Healthcare. I think you probably have all gone to the website, and we're going to poke around there a little bit as well here in a few minutes. But our focus is on that topic. But normally, when I do these monthly webinars, I focus on other things, other topics. It is about education, not selling you something in the normal monthly webinar. We talk about don't stop the marketing for the summer. That's an important part of my messaging for last month. Is we really need to keep things moving along. This is a real important time of the year. I've also covered in recent topics. I've covered planning for your rural hospital and clinic marketing program. I think that's an important contribution as well. As a matter of fact, I'm just kind of curious here, about who's attending here today. So if you would just kind of, I've got a poll there that I'm going to launch. There we go. Let me know what kind of role that you play in the hospital, and just pause for a minute while you catch up there. Okay, well, we've got an awful lot of C-level executives here today, and some community relations and marketing folks, nursing administration. The book in attendance is the CEO administrator for today's program. So thanks, everyone. I appreciate that. That's it just happens to be the case in small and rural hospitals, isn't it? Where we have a tendency to have to do a lot as the CEO administrator. Even the marketing director, has a tendency to, have two or three other titled positions as well in that role. Anyway, so we've talked about planning. Planning is so important. Follow the money, swing bed. Another topic that I covered recently, and it was so incredibly important. Swing bed is a very, very important life-saving program, if you will, for our small and rural hospitals. It's also a fabulous benefit to community members, that have family folks that are needing that particular service. It's a tragedy, I think, when a spouse is admitted into a swing bed program for 21 days at a neighboring hospital, and the spouse that's not in the hospital, or family members, mothers, sisters, daughters, have to travel 45 minutes there and 45 minutes back, and do that every day, get on that dangerous highway. People need to know about what we have available in our swing bed programs, and that we do have that service available when it's needed, and people meet the criteria. Getting the biggest bang out of your marketing dollars and your marketing program. What did we need to do? That was a program that we covered recently. And another one is, what should a hospital marketing communication person actually be doing? And I think you're going to be surprised at that. As a matter of fact, we're going to kind of cover that here in a little bit. But it's an important topic. But you kind of get the idea of what we do with this program normally. It's not about telling you about SRJ Easy Healthcare. It's about giving you the information you need for your hospital. And so, let's just kind of jump into it. I do have a special offer for you. I'm going to tell you what it is right now, so you can plan for it. I want you to become a member, and for the first couple months, I want you to be invested in it. I don't want it to be free. I want you to invest in it because I want you to use it. and we have a tendency to value things that we are paying for. And so month number 1 and 2, you'll pay for it. It's an $850 program. And month number 3, though, I'm going to give that to you. I think you're going to like this program a lot. I think you're going to hang out in it. We're always updating materials. So if you're in the program a year from now or 2 years from now, the program materials will actually be added to and changed as well. And there's no contracts. You can cancel at any time. That's part of the coolness of SRJEasyHealthcare.com. Is you don't have to make a long-term commitment. I hope you do. I think you're going to find it to be an incredible resource, but there's no long-term contracts or anything like that. So it has been a very, very busy spring. And, you probably thought for a minute, well, I'll just sit back and kind of coast during the summertime. No, not so much. This is where we really need to stay in front of the audience. And it gets tougher, quite frankly, because the kids are out of school and everyone's going in a different direction and they're at the lake or they're vacationing or whatever. But exposure equals awareness equals sales, and we need to always remember that because summer marketing is critical for your fall and winter business. As I said, exposure equals awareness equals sales. And so while it is that marketing is not a choice, what we decide to do is a choice. That's what I want to kind of focus in on here and why SRJ Easy Healthcare exists. This is my 29th year in business. It was 29 years ago, a couple months ago, that I worked with my first small hospital in the panhandle of Texas. And that became a specialty of mine, and that's all we do now, is work with small and rural hospitals. And I'll be honest with you, we're not doing enough in most of our communities. Not SRJ Marketing Communications, we're doing a lot. But the folks that are not part of our program, I find that they're just not doing enough in their communities in most cases. And that is why I developed this particular program. Is to give you the tools and resources that you need, because not everyone is a writer or designer, or and so you need design tools or professionally developed ads and that sort of thing. This is what we'd love to have our programs look like. Public relations and our website and advertising and community interaction, all that put together in one place. But what I see so often, unfortunately, is sort of this fragmented approach, where we may have a website and it hasn't been updated for 2 or 3 months. We may have collateral material, we may not. It may look the same. It may look like it's done by 7 different people over a 7-year period. We might put out a press release once in a while. We might, you get the idea. It's just kind of, oh my gosh. Again, we want to bring it together in this sort of way so we can get a very comprehensive look. And that's what I've tried to do with SRJEasyHealthcare.com, is to give you that full comprehensive view. And so let me give you the highlights of what it is, so you just have an idea of the comprehensiveness of the program. First of all, there's the toolbox, and I'm going to get into the back end of SRJEasyHealthcare.com in just a minute. There's training and webinars like this, only most of the time I'm not trying to sell you anything, I'm trying to educate you because you're already a paying customer. But there's programs where we talk about the kinds of things that we should be doing during the summertime. There's focused coaching, where you have an opportunity to call me and to brainstorm with me specifically, not someone on my team, but me specifically, about something that you're considering or something that you heard in the webinar. I'm a big fan of interacting with the school system, and I may spend 15, 20 minutes on a call to figure out what is right for your community in that interaction. You also get discounts for professional services. You can you'll get a customized brochure or a website or a social media program or all those kinds of things, and those are discounted if you're a member of SRJ Easy Healthcare. I have professional healthcare writers, I've got graphic designers, social media professionals, etc. And so we've got a lot of things going on, including our proofreader. So all the things that are there, have you've got access to all of this either through SRJ Easy Healthcare or in the other services that you may want. So I want to, at that particular point, I'm going to pause this screen specifically as I jump over here to SRJ Easy Healthcare, and I'll show screen, and there we go. So you probably have all been here, which is SRJEasyHealthcare.com, and you can see that there's a variety of different things, and I'll let you read through that on your own. But I'm going to just snap ahead here to the things I just covered, the things that are part of your monthly membership. And remember, it's a monthly membership, no contracts and no commitments. And those things are things that you get as a member, including the support that you need in the development of a marketing plan. If you decided to contract with us to develop that marketing plan and implement it, then we can talk about that as well. That's called a retainer service, and those are available as well. And of course, as a member of the SRJ Easy Healthcare, you get a discount there. I'm going to slide down. This is all in the same website. I've just pulled up these screens for make it a little easier. So again, there's expertise. I've been doing this for a long time for small and rural hospitals. That's what our company is about now, is specifically the rural hospitals. When you combine all the services that are available to you, I've estimated that it's a value of $5,000 or more on a monthly basis. So I really do think that 120 or more customized press releases, over 2,000 media posts selected for the month. So when we get into the back end here, you'll see the social media posts, and Men's Health Fitness is the month of June, and there's a press release for it, there's an ad for it, there's a radio spot for it, there's even social media that is specifically designed for Men's Health Month. And of course the newspaper ads that are customized. I want to show you this one. Look, let's see if we can get to it. Examples. There we go. Look at all things that we did in the month of April, May, and June. So all of these things are in the toolbox, which is where we're going to go to next here. Volunteer Week and Hospital Week and Laboratory and Nurses Week and Immunization and EMS Week. And I'm not asking that you use all of these because you're the marketing person or you're the CEO. What I want to do is to allow you to have a pick and choose so you can create and have the tools that you need readily available for you to work with. I want you to be able to click through and find what it is that you need. Some groups don't use Nurses Week, for instance. They do all of their Hospital Week, Clinic Week, and Laboratory Week, and Respiratory Therapy Week during Hospital Week. I think that's a really bad idea, by the way, and let me give you an example of why. The very first hospital that I worked with, I was interviewing the guy that owned the radio station for many, many years, attended the board meetings, was on-air personality. In other words, he was in the know. And his question to me, we were trying to determine whether or not the community would support building the new hospital. And he said, well, Steve, the problem with that hospital is they don't even have RNs. Oh my gosh, right? I mean, this is the guy that does the news every day. And he says, I didn't know they don't even have RNs. I mean, he was certain about that. Well, they had more RNs on staff than LVNs. And so what we did over the course of building that hospital, the community supported the goal to build the hospital. We pumped over 300 stories into a 5-day-a-week paper, 300 stories over about 2.5 years into that community paper. And a lot of times we'd say, I'm not an RN, but Steve Jolly, RN. And so that's why it is that you need to, people don't know that you've got registered nurses. They don't know that you've got a laboratory service that can do general lab work and beyond. They don't know that your physicians offer immunizations. And so we want to create an awareness, build the level of awareness of all of our hospital clinics and providers into the community. And so I give you lots and lots of choices on how to do that. So there's a place on here where it says log in. I'm going to do that right now. And we're going to go into the back end of SRJEasyHealthcare, and you will see how amazing this is. As a matter of fact, the guy that you created that first website in 1995 for a hospital in the Gulf Coast of Texas created this. So he's a fabulous, amazing programmer. And so let's just go to physical therapy, because I think this is a good promotion for the month of July, is physical therapy. I'm just going to download a press release and bring her on up. And there it is. And so this press release is already done in a draft mode. This information up on the top here would be, you would change that, and I'm going to show you how to do that here in a minute. We're quoting individuals. Most often that's going to be in red. So here we have our Tabitha Morris is our physical therapist at Johnson Regional Medical Center, and that's all filled in for you. This is written in a professional style. And oops, look at that. That goes on the second page, and this is a Word document, and so that's how easy it is to fix that. And you can see that this press release is already done. Physical therapists work closely with the patient's physician to design a recovery program that addresses a person's individual health needs. Professionally written by a writer that's been writing for healthcare for, goodness gracious, 16, 17, 18 years now on my staff. So you can see that is already done for you. A little bit about Johnson Regional Medical Center, which I just made up the city and all that. But you can see how incredibly useful this is. And that goes on and on, folks. We can go to the press release for Men's Health Month, and we pull that up. And there it is. There's Men's Health Month for you. Johnson Regional Medical Center highlights Men's Health Month. Now, how many of you ignored Men's Health Month or had to write this press release and send it on? It's done. It's already done. And it's in a Word document for you to edit like it's your own. Print it out, send it for approval, send it to the newspaper. Already done. And that just goes on and on, folks. There's coming up 4th of July weekend. Here it is, 4th of July weekend. Now, 4th of July, what does that have to do with the hospital? Well, I want you and your providers to be the one that writes that story for safety, because they're going to pull it off the wire and have a story. They are. So why not have your hospital and your EMS director and your providers talking about Independence Day? Exposure equals awareness equals sales. And so this is a great way to bring this together and have a constant grouping of press releases going to your newspaper. Now, why am I so big on press releases? A press release is worth 3 to 5 times more than that advertisement that you're paying for. And you should never, ever pay for a press release, by the way. And if your newspaper is wanting to charge you for that, then you definitely need to give me a call, and we need to talk about retainer services. Because if you pay $200 for an ad, then your press release is worth $600 to $1,000. And why? It's called third-party endorsement. It's like the paper has written that story and endorsed it. And so now it's a story, just like all the other stories. It is more valuable than the ad. And let me tell you, you got to add. You got to be an advertiser in your paper. You need to support, as the hospital, you need to support the paper. And oh, by the way, the ones that are reading the paper, they're your target audience. Those are the older folks. Those are your target audience. You need to be communicating with them. Social media will pick up the other side. And oh, by the way, let's go back up here to the top, and let's just look at July social media. There we are. And notice it's also in a Word document, able to be edited. And there we are. We've got rattlesnakes for that part of the country. We've got your favorite time to work out. These are what I call the general posts. Now, this is a big mistake that people make. They think that what people want to see about the hospital is their CT scanner or their employee of the month or the laboratory equipment you just bought. And you know what? That's great, and we do want some of that. But what they really want, people care about what they care about. Lots of water, number 6 on the list of important to remember for athletes. I'm an athlete. I want to know what's important to me. What's in it for me? Your CT scanner, not so much in it for me. I'm glad you got it. And so we wiggle those things in. Look, when we get down here, I'm scrolling real fast here. There's 4th of July safety. Remember I told you we had social media to go with your 4th of July? And look, there's several different kinds. What is your style? What is your what do you want to say? That is available for you to pick and choose, not to use all of them, but to pick and choose. I want to give you choices. Juvenile arthritis, there's a story over in the toolbox for that, and there's the press release. Summer heat and exhaustion, that can go in front of or back of the 4th of July. You get the idea here, right? And now we start scrolling down here, back to school immunization. Now we're calling your clinic. A little bit of you and lots for them. Okay, that's what social media is about, is a little bit for you and lots for them. And so that's what we've put together for you there. Some amazing tools, and you see it just goes on and on. Back to school physicals, for instance. Now here, by the way, is a press release on swing bed, and I want to tell you how to maximize that. And this is what these webinars are normally about. So you have a swing bed press release, and then you go and speak to the Senior Citizen Center. Okay, and so now you've got education, and either before or after that, you're talking about swing bed. Now there's a whole bunch more that goes with swing bed. That's get out from the desk and go do. But that's I'm not going to get into all that right now. So that is the toolbox here of SRJ Easy Healthcare. There's just so much going on and a tremendous amount of value there in the program. So I'm going to invite questions if you do have questions about it, and I'm going to go back now into the PowerPoint presentation because I want to talk about a little bit about your program and what is available. So if you want to hang on, now you know a little bit about SRJ Easy Healthcare, and I'll say a few more things along the way about that. But people make new decisions based upon new information. So I want to give you some new information about what these webinars are normally about, and that is part of the value. There's thousands of dollars worth of value there in your membership, in social media posts and press releases and newspaper ads. Oh, I didn't even show you newspaper ads. I'll come back to that, but there's newspaper ads that go with those as well. But so that being the case, I want to just share with you some of the things that you could be, should be, might want to consider for June, July, and August. Promotion to that swing bed program. That is what you really need to work on. It's going to be the place that you're actually going to make some money for the hospital. And so that's a good thing to concentrate on. Calling on your regional providers. Your providers, we don't do brain surgery in rural hospitals, and that's all I work with, by the way. And so, your providers are needing to send people to the orthopod or the neurologist or whatever. And so we want to call on them, like physically, someone needs to be calling on the regional providers, like out from the desk and go and talk to them and share with them. And let me just give you an example of what a marketing program can look like. This is one example. I was just fascinated when I heard it, but this is all they did, and so they got 2 patients instead of 200 patients, 20 patients. What they did is they sent a swing bed postcard to the discharge planners at the surrounding urban hospitals. They ended up with 2 patients from that postcard specifically. Now, if they would have done a bunch of other things that I suggest, that would have even been maximized even more. But think about it. Call it $1,000 a day benefit. I don't know what it is in your hospital, but $1,000 a day times at least, sometimes 20 days, 21 days, that's 1,000 times 21, right? If they have lab work, that's additional. If they have to be admitted, out of the swing bed program, that's an admission. CT scans, all of those kinds of things, because of that postcard, that one postcard. Now you do a bunch of other things like recommend, and that number goes up. The other things that we want to do with our time is community involvement, getting involved in the community and staying involved. Interacting with the community and the senior citizen centers, if you've got one in your community, places of worship, coordinating and promoting events. These are the kinds of things that a marketing team member should be working on. Or a lot of times we just have the CEO and department directors, and we've got to create some energy with that. What you don't want to be doing, because time and resources, I rarely meet a marketing director that doesn't have 2 or 3 other responsibilities, and because this is small and rural hospitals, right? And so I've worked, for my clients that are on retainers. Sometimes I'm working with the administrative assistant. Sometimes I'm working directly with the CEO. Sometimes it's the medical records director. I've worked with the radiology director. Because we have multiple roles in our community hospitals. But what doesn't happen is the fact that those people are not professional writers, so no press releases go to the paper. They're not graphic designers, and so we entrust the graphic design to the newspaper, which is usually awful. The newspaper is there to publish, not to design. Radio spots, are done at the radio station. So, that's what happens. And now it doesn't have to happen because you've got SRJEasyHealthcare, right there, and you've got all of that available for you to customize and edit as you need to, which takes 10 minutes instead of a couple hours. So I want to kind of explore here with you, give you some additional ideas of your summer. So for those of you that can hang on and want some ideas here for a minute, I want to go through some things for the summer that you can do. Like stay involved in your community activities is a good thing. Stay in front of your audience with advertisements and PR and social media. You might want to pick on one of these particular goals. For instance, if your social media program is not where it needs to be, you really concentrate on that, and now you can because you've got a gazillion of them in SRJEasyHealthcare. And go sell your services. Get up and go. You could also, and I'm going to run through these real quickly, by the way, just to stimulate your ideas and to, quite frankly, stimulate your interest in SRJEasyHealthcare, because this is what I do every month for our members. Is we talk about what does it mean to set up a lunch and learn program. We talk about email marketing and how to do that. Just a variety of different things are going on, and so the school system, great time to invite the athletic directors and coaches over to meet your physical therapy department and see what you've got available there. Certainly the back to school programs are great. So just kind of rushing through on this get up and go philosophy and invite folks in, stay involved, parades and community events and senior citizens. Maybe you want to organize a walk-run event for breast cancer awareness, that sort of thing. Chamber of Commerce, lunch and learn. You get the idea. There's a bunch of stuff. And if anyone has ever participated or organized this kind of stuff before, there is a lot of time involved in doing that sort of thing. But it is the place that will have the most impact. You now have, through SRJEasyHealthcare, you have the radio spot and the press release and the newspaper ad and the social media done for you. Now you can concentrate on getting into the community, which is not something that I can, put on the website. So this is the kind of thing that's going to make a difference in your community and set the stage for your fall and winter busy season. So all kinds of ideas here that we go over every month, in our programs. Um, and keep those articles going to the newspaper. Remember, public relations informs and advertising sells. Right now in the SRJ Easy Healthcare, there's men's health and there's UV safety, there's healthy eating, there's kids summer safety. There's just a bunch of stuff, as I already shared with you, in the toolbox, and keep advertising. And you can choose to advertise one of these or several other kinds of what we call service line marketing. So one is information marketing, that awards and benefits and things like that, and that's where you would get discounts if you need a specific press release or campaign to introduce your physician or provider. But these are also service line, and we shared, for instance, the physical therapy already. Internal things that we could be, should be, want to be doing during the summertime. You might consider a customer service program. I did my first customer service program 28 years ago, and the folks asked me to do that, to come up with something, because the team members felt like they were the only hospital in town. Where else are these people going to go? And they kind of behaved that way and sort of had a difficult attitude. And in rural America, a drive to the next hospital down the road, 45 minutes, an hour, where we can also do more shopping and buy gas and that sort of thing. That's just kind of a normal kind of day, right? And so that's where people would go. What we do have that the larger hospitals do not have is that individualized experience where it's very personable, that hometown experience in customer service. And so I teach that particular program on customer service and leadership development. This is a slower time of the year, good time to be doing that kind of thing. A few other things that you might want to be considering for your summer activities. Your toolbox has it all. I hope that you'll consider strongly sending me an email and taking me up on my offer. The third month will be free. Let's get you signed up. Honestly, we could have you signed up and active by the first of the week. And so it's a great time to get going and get your program going. Well, it all happens in conversation, and I want to continue the conversation with you. As members, I offer this laser-focused office hours where this particular month I'm going to be available right then and during these hours, to the SRJ Easy Healthcare customers, members, and they're free to call me during those hours as part of their program, which is a great deal, quite frankly, and they'll talk directly with me. They won't, it's not a staff thing. I'm the one that has the 40 years of marketing experience and almost 30 years in rural healthcare. And so you're going to ask me questions, and we're going to brainstorm together as members. I do want to invite you, and you'll receive an invitation because you attended this one, to the next webinar on July 17th, and that will be more focused on what we need to be doing for the fall. There won't be any selling going on in that particular one. It's focused on what it is that you need as a member to further market your hospital. So you have a question, give me a call. Email might be a little bit better for me, steve@srj.net. That might be the quicker approach. And one last time, I want to just remind you about the special offer. Send me an email and let's get connected. There's no contracts. You can cancel at any time. And one last thing, marketing and PR is not an expense, but rather an investment in your future. And I strongly believe that. I think we all need to do a whole lot more of that. Remember, exposure equals awareness equals sales. So invest in your hospital, and let's make that happen. I'm so grateful that you came in today. I hope to hear from a lot of you to get you started in SRJEasyHealthcare.com. Thanks so much, everyone, and we'll see you at least next month. Thanks. Bye.